It is Friday morning. I saw another iguana earlier this week, and I just finished saying, I don't get to see iguanas very frequently anymore. I see, beardies probably, two a day, and then during the week, and it's just awesome to see another iguana this week. So anyway, and now I've mentioned it, made a big deal of it. There's got to be a third one coming in here somewhere because they always happen in threes. Anyway, this one has been living in an enclosure with some rabbits. What you can notice is the redness right there in the mouth and lips. We definitely have a stomatitis going on. I have swabbed that. That is chock full of a diplococci. I actually took some pictures of the microscope so I can add some slides to this as well. This one actually had gone down a rabbit hole and was stuck in the rabbit hole and somehow bent almost in half. So what's kind of odd is on the x-ray, and I can add those to this video as well, is on one view it looks like we have an injury back here where the caudal tail is broken, and you look at the lateral, and the lateral shows that we have an injury up here, but not quite high enough that I think it would make the nerves quite innervated. But it turns out to be uninnervated, excuse me. But it turns out that we are a little bit on the paraparesis side. So hopefully, I'm thinking that if we get this guy on some anti-inflammatories, also in this fecal we actually have Eimeria or some Coccidiosis. So living with rabbits and guinea pigs has not actually fared for this girl well. I'm not seeing any signs of eggs or problems as far as that goes, so I'm wondering if she went down the rabbit hole to lay some eggs. She has been without a male for at least 5 years, we can tell, so chances are they're not, what's the word I'm looking for? I need another cup of coffee. Anyway, sorry, let's get back to this girl. Fertile, that's what I'm looking for. Thanks, man. I can get some off on your chart when you bill for that one. Anyway, we're going to go ahead and treat her for the Eimeria. I'm going to use a sulfa drug. Hopefully the sulfa drug will also help with the stomatitis here as well. We'll probably notice within by Monday or Tuesday you'll be seeing a lighter pink inside that mouth area if we hit the nail on the head. If not, then we may have to use a different antibiotic or get that culture to see. Okay. In the meantime, the sulfa drug is aimed at the Eimeria, and the anti-inflammatories will be at any pain and inflammation here in the spine. So, and this girl is not really a nice girl, but she did pretty well for the x-rays, didn't offer me too much of a hassle. Does she drink out of that bottle very well?
Yes.
All right, so she got that figured out too. Anyway, and as you can see the way she's breathing and swallowing, her stomatitis has probably also turned into a respiratory tract infection. So I expect to see an improvement by all of those things by early next week, and if not, let me know.
Good.
Okay? It turns out that this particular creature belongs to a nursery. I've even seen pictures of an alligator, a permanent alligator. The only planet that's got a permanent alligator, by the way. Although I'm not allowed as of yet to start mentioning the nursery's name, if you guys are ever in DeLille and you decide you want to go looking at all the nurseries there, one might actually have this lizard in it. All right, or several lizards. Okay, that's it. Over and out. Later.